Good morning. As a sponsor and author of Republic Act number 10354 or the Responsible Parenthood and Reproductive Health Act of 2012, otherwise known as the RH Law, I am pleased to be with fellow health advocates as we celebrate the 10th anniversary of this law. I would also like to take the opportunity to thank Likhaan Center for Women's Health for organizing today's event and for all the work that you do. Maraming salamat. Universal access, a whole-of-government and whole-of-society approach, is necessary for the full and intensified implementation of the reproductive health law. Clearly, we need adequate funding. We need to ensure access. We need to ensure that the logistical support is also there to ensure that women are able to get the supplies that they need. While primarily a health issue, other agencies of the national government like the Department of Education, Department of Social Welfare and Development should be involved. LGUs are also the frontliners in the delivery of this service, and they must be up to speed with the importance of family planning and reproductive health, and they must be able to cooperate and be willing to cooperate with us. The national government must be ready to assist the LGUs to ensure that the RH services will not be disrupted. Further, engaging and building the capacities of community-based volunteers is also very, very important. So what are the lessons we learned? The RH experience was about breaking down a very difficult topic and speaking clearly about the issues and patiently enduring not just negative comments but outright attacks for pushing for this bill, but also patience in explaining it to people who did not really understand what it was about. I always use the example that as an endurance athlete, I have been trained to outlast my opponents. And I always kept the finish line on sight. And my goal was to pass this measure so that it would be able to help women and families. Number 2, deeply rooted and ingrained beliefs or biases affect the kind of laws that pass Congress. Remember that Philippines is still a male-dominated society. And though I've worked with very supportive men who were very supportive on gender issues, on women's issues, the reality is a lot of men in general have biases in the same way we all have biases on what reproductive health is all about, on access to contraceptives, and so on and so forth. At that time, only 21% of the members of the House were women, and only 12.5% of the senators were women. That said, not being a woman in itself was not a guarantee that one would vote for the reproductive health law. Again, every individual is a product of their belief systems that they grew up with, and it really continues to take an open mind to be able to work through biases that we may each have and listen, which I feel is a very important characteristic that a lawmaker must have. Today, there are many more members in the House of Representatives. There's 27% in the House and 29% in the Senate. We are now closer to the critical mass of 30%, but this is still a far cry from what we hope to achieve, which would be closer to 50%. During the RH deliberations, some of my male colleagues had said, I am anti-RH because what surprises me is in the rural areas, without the assistance of doctors, women give birth. Hardly anyone would die. I do not know why they die in hospitals. That is not accurate. Women do die giving birth, and their chances of living, their chances of overcoming complications are greater when they are in hospitals. Another statement is, more men die going out to sea or into the fields to earn a living than women dying giving birth to a child. Well, we all face challenges or even life-threatening circumstances. Fishermen truly risk their lives at times being out in sea, but this in no way should take away from the dangers of giving birth, which is a fact. Even in today's modern day, women can still die from childbirth. And the other statement is there are no names, no faces to 11 maternal deaths a day. I was actually asked to produce names, and I did, but this did not change their minds. So there continues to be a lack of understanding on the need to separate personal and moral views from what needs to do as a legislator to represent the needs of an entire nation. Women's rights are human rights. Reproductive health is a gender issue at its core. There remains a greater need to push for true gender equality in our laws and societies. Strong political and a solid partnership with civil society is vital in propelling progressive legislation. The RH law was passed through a consolidated effort of persistent proponents in the House and Senate, solid backing from women's groups, the youth, businesses, and other sectors of civil society, and the strong support coming from the President. In conclusion, we cannot overemphasize. We must again and again ensure that women understand that family planning and access to services and support system and health services are available for them, and we must make them available at the local government level. With the law in place, women are given that priority, but we must have that whole of government, that whole of nation approach to make this happen, and we must reaffirm the right of our people to the highest standard of health. Thank you.